Welcome back to The Explainer. If you're a health administration student or a current healthcare executive, you are in exactly the right place. Today, we're basically setting the stage for an executive masterclass on building truly accountable, resilient systems. We're going to unpack a brilliant analysis by Rapush Duvallari called The Billion-Dollar Leak. It completely reframes why our massive public healthcare programs constantly struggle with oversight and, far more importantly, how we can actually fix the architecture underneath them.
$100 billion. Let that sink in for a second. That is roughly the amount that Medicare and Medicaid lose every single year just to improper payments. It's a staggering number, and it's been hovering between $70 and $100 billion for over a decade now. But here is the crucial paradigm shift we need to make today. When financial leaks keep happening at that massive scale, the root cause isn't just misconduct, it's the system's design itself. It's fundamentally an engineering problem.
We've got a packed syllabus for this explainer to shift our thinking from reactive enforcement to proactive structural redesign. We're going to hit 1. The systemic drift problem. 2. The aviation safety parallel. 3. Structural flaws versus individuals. 4. Integrating automated anomaly detection. 5. Launching the claims pilot. And finally, 6. Building structural executive accountability.
All right, let's jump right into part 1, the systemic drift problem. Why do these massive public programs keep leaking money year after year?
Well, it all boils down to systemic drift. This is what happens when an institution's complexity and scale just totally outpace its built-in discipline and oversight. You see, systemic drift isn't some dramatic overnight collapse. It is way more insidious than that. It's a gradual, silent normalizing of instability. Think about it. We've gone from about 17,000 billing codes in the 1970s to over 70,000 today. As all those new rules pile up, tiny little errors just quietly compound into massive accepted losses.
And here's where scale completely changes the game. In a trillion-dollar system, a tiny 1% error rate equals $10 billion. Boom, gone. That is the entire annual budget of a mid-sized state literally vanishing due to a 1% variation. When you are operating at that kind of scale, informal checks and after-the-fact audits simply aren't going to cut it anymore. You need a totally different approach.
Which leads us perfectly into Section 2, the aviation safety parallel. We're going to look at how another incredibly high-stakes industry tackled this exact same problem of normalized instability. This comparison really hits the nail on the head when it comes to operational mindsets. Over on the left, you've got healthcare. We're currently stuck in this highly reactive pay-and-chase audit loop. The money goes out the door, and then months later, an audit might spot a mistake, causing everyone to scramble and desperately try to claw those funds back. But on the right, aviation. They use a proactive black box approach. They are continuously monitoring flight data in real time, instantly catching and correcting anomalies before catastrophe ever happens.
And honestly, the results in aviation speak for themselves. By shifting to that continuous, proactive monitoring, commercial airlines slashed their fatal accident rates by over 90% in a single decade. 90%. They absolutely refused to accept crashes as just a cost of doing business. Instead, they engineered safety directly into the daily workflow. And healthcare can absolutely pull off the same transformation by embedding immediate statistical process controls right into the payment workflows.
So, moving right along to Section 3. Structural flaws versus individuals. It is time to distinguish between a personal mistake and an actual system-wide vulnerability.
I love this foundational quote from quality pioneer W. Edwards Deming. A bad system will beat a good person every time. It's absolutely crucial to grasp this. Deming is telling us that quality and stability aren't just about individual willpower. They are properties of system design. If improper payments are happening every year at the exact same magnitude, your system is waving a giant red flag that it's fundamentally unstable.
And the data backs this up perfectly. Look at this. 85% of improper payments are actually driven by structural weaknesses. We're talking confusing coding rules, vague training, clunky system errors. Only 15% is driven by deliberate fraud or individual malfeasance. Right now, we're basically trying to arrest our way out of an engineering problem, and the math clearly shows why that's a losing battle.
For the executives and leaders tuning in, this distinction right here is everything. You've got to understand the difference between special cause variation, which is just a one-off isolated mistake, and common cause variation, a recurring error that's baked into the system's design. If you treat a common cause variation like it's some isolated crime, you completely fail to fix the root architecture.
Like if an intake form is constantly filled out wrong because the instructions are terrible, punishing the clerk doesn't fix the form, right? We have to engineer that operational variation out of the workflow entirely using statistical process control.
Okay, let's get into the practical how-to with Section 4, integrating automated anomaly detection. How do we actually bake statistical process control, or SPC, into our modern hospital billing workflows? The source outlines this incredibly robust 4-layer AI architecture. Think of it as a massive acceleration layer sitting right on top of your statistical process controls. Layer 1 brings in machine learning for real-time prepayment screening. Layer 2 uses pattern intelligence to sniff out weird novel fraud clusters. Layer 3 gives us continuous risk scoring for providers, and Layer 4 ensures we're continuously monitoring the entire network. This AI doesn't replace your foundation, it supercharges it, so you catch the leak before the money ever leaves the system.
Let's walk through how this smoothly integrates into real life. Step 1, a claim gets submitted. Step 2, bam, the SPC and AI pre-check instantly analyze it in real time. If it finds an anomaly, it pauses the claim right then and there. Step 3 is human verification, maybe just shooting a quick request to the doctor for clarification. And Step 4, the correct payment is finally released. The beauty of this? The whole cycle takes hours, not months. We stop the error without delaying normal patient care for a second.
All right, Section 5, launching the claims pilot. Because let's be real, you can't just flip a giant switch on a trillion-dollar system overnight. We need a practical roadmap.
Scaling this kind of tech requires a highly disciplined timeline. Phase 1 is the foundation, the first 6 months where we establish baseline data audits and configure the statistical thresholds. Then Phase 2 is the operations stage. That's a full 12 months of running this prepayment screening on your highest risk billing categories. Finally, Phase 3 is evaluation, a strict no-nonsense review of the outcomes to decide if the pilot is ready to scale nationally. It's treated like a highly controlled experiment.
And we have to hold this pilot's feet to the fire using pre-committed operational metrics. The correction cycle time must stay under 5 business days. The false positive rate has to be under 8%. And arguably the most critical metric, there must be absolutely no measurable reduction in a beneficiary's access to care. We have to make absolutely sure we are stopping waste, not creating an administrative bottleneck that hurts patients.
Which brings us to our final stop, Section 6, Building Structural Executive Accountability. This addresses the ultimate leadership mandate for all of you current and future administrators.
The source poses this really provocative question, and I want you to think about it. What happens to accountability when the leader is gone? It's so common for an organization to look highly disciplined simply because of one charismatic supervisor holding it all together. But guys, performance under supervision is not the same as resilience. When that key leader steps down, all those hidden compliance failures suddenly bubble up to the surface, and the system drifts right back into chaos.
And that brings us to our major takeaway for today. True accountability only survives leadership changes and political cycles when discipline is permanently baked right into the architecture. We have to prioritize long-term structural redesign over short-term reactive enforcement. It's all about building a system that literally corrects itself. So I'll leave you with this to ponder. Is the system you're managing right now built on true structural resilience, or is it just surviving on the sheer willpower of the people currently running it? Give that some thought, and I'll catch you in the next explainer.